Hi Peter, it's a pleasure to meet with you today. To begin with, could you introduce yourself? We're here in the beautiful headquarters of CIPD. What is your role here?
Yeah, so I'm the Chief Executive of the CIPD, which is the professional body for HR and people management, people development. We have around 150,000 members and continue to grow. You know, the whole debate now about the future of work and about looking after our people and productivity and so forth is a very big and rich agenda. So we engage in a lot of different themes. And I've been in this role for 6 years now. Prior to that, I had a long professional career in consulting. I worked at Accenture for many years, so one of the big global consulting businesses, and led their practice around all the people stuff, so HR, organizational strategy, change management, leadership and development, and so on. So I've always had a strong interest in these sorts of themes. And then after leaving Accenture, before I joined here, I also had a period when I chaired something called the Institute of Leadership and Management. I engaged and talked a lot on the subject and theme of leadership and management, which has always been one of my real interests. And we're at times of great change when this sort of subject and debate is very key to organizations everywhere.
And before we go on to speak about some of those debates, can you tell me a bit more about what it is that attracts you to this work? So thinking about people, thinking about work, but also reflecting back on your own career trajectory and how you got here today.
Yeah, I suppose, I mean, one of the unifying themes throughout my life, I think, is I sometimes describe myself as a bit of a humanist. I mean, I think people are of themselves fascinating and interesting, but of course every business is really about people. As somebody said to me a while ago, there are only two things you have in any business. One's money and the other's people. And how we engage people, look after them fairly, help them to deliver their best, align them to the organization, all these debates about culture, are so fundamental. And yet we haven't always paid enough attention to them. We've had a long period, I suppose, over the last sort of 40, 50 years of a lot of business thinking, which was very much about procedure and process and rules, and that was the way to optimize things and standardize everything. Well, that'll take you only so far, and I think what we see in today's world is a much, much more debate and discussion about how do we empower people, how do we engage them effectively, how do we look after them properly, because the world is changing very fast, and we need everybody to have a level of voice and engagement and opportunity to share their perspectives, so that in the end, you know, the whole is greater than the sum of the parts. So I think there's a lot of thinking going on now, which arguably we perhaps forgot from days gone by, with a long period of time when so much of business seemed to be, as I said, about rules and policies and processes and standardizing everything and process re-engineering and all these ideas and putting in big IT systems to make it all look standard. And I think the world's moving on from a lot of that. And at the very heart of it is about people. It's about individuals. It's about recognizing them for all of their qualities and all of their attributes that they bring to work, both good and more challenging. And how we manage that effectively and create, as I said, working cultures and workplaces that are good for people and that help to get the best out of them. And I think that's a very fundamental idea and something that has probably driven me through a lot of my career.
So you've been a senior leader for quite a while. Have there been times where you have felt that some of these dynamics have perhaps disadvantaged your own journey and led to frustrations which have then made you such an activist in this area?
Yeah, I think we've all experienced it in different ways in our workplaces. I mean, I was very fortunate to work for a great organisation where actually at the heart of the values of the organisation was a lot about people. It was a lot about ideas like stewardship, which is a very powerful idea in my mind about whoever we are, whatever position we're in. Part of our legacy, if you will, is how we support others and how we, as is often described as how we make sure that we leave things in a better place than when we found them, and that's part of our stewardship responsibility. But yes, of course, we've all experienced it in different ways, and this idea, and indeed I would also say, as I've often said, that in my experience as a consultant, certainly during the 90s and noughties, that a lot of what we pushed out was this idea of here's best practice, and we need to standardize things. That's the way to drive efficiency and therefore best outcome. it wasn't all wrong, but as I said, I think the world has moved on a bit from that. And this is one of the big business challenges now, is how do we do these things in ways that are manageable and understandable, because it arguably makes it more complex, and understand the outcomes that we're trying to drive for and the evidence that will support that.
So these discourses around standardisation, outcomes measurability, so they've existed within the public sector since the early 80s and become rather embedded. Now, you say that we need to take a different view. Can you tell me a bit more about that in the context of the public sector?
Yes, because public sector is obviously such an important sector. And it's not to say that the world we need to move to is one of everybody choosing to do what they want to do. I mean, you clearly need frameworks and structures, and of course you need process in many, many parts of business, and public health is a very good example. But within that, we've also got to create this opportunity where people feel like they've got voice, they've got a degree of empowerment and responsibility, and with that goes accountability as well. That we train them, support them, and engage them effectively, that managers at all levels are understanding those things. And that's as true in public health as it is anywhere. But it's about finding that right balance. And that is a lot about context. It's about understanding the context of the business and the environment in which that business operates, be it public health or anything else, which is why these sort of very standardized approaches to everything, standard models and so-called best practice, I think really we have to move beyond that and understand, okay, there's some big principles here which we want to think about in terms of a good organization. We can come back to some of those. But then what is the context of my business, and where must I have rules and process and procedure? Because we have to have something that governs things like public health, some very obvious, literally life or death situations, where there will be other working environments, other sectors, and you see this emergence of models now in businesses saying, well, I almost want no rules, and I want to truly empower people and let people do within much broader boundaries, do what they want to do. And as I said, that's a very contextually sensitive thing, which we all need to understand. But examples in the public health, where I think public health sector, certainly in the UK, where we've really understood that driving everything through rules and process has consequences, has been unfortunately demonstrated many times in the public health sector in the UK. If you go back a number of years, there was the whole debate about mid-staffs, so one of our trusts in the northwest of England, where there was some rising morbidity and mortality rates, and a lot of things really not working at all well. And the sad fact of what came to be understood was people talked about a culture of mid-staff's hospital trust, that it was a culture that was very, very driven by rules and targets to such an extent that the healthcare practitioners themselves even lost sight of what they were supposed to do. And ultimately, one of the reasons public health is so interesting is because people that work in public health are typically very, very driven by a big purpose. They want to help people, they want to help people get better. It's a very profoundly purpose-driven culture and environment, and it's extraordinary how, even with starting with that you can create a culture that has moved away from that to the extent that we've seen in examples like mid-staffs, because of everybody just pursuing targets and numbers and process, and therefore losing sight of what are we here to do. And what is profound about all of that is about an understanding of human nature and behavior in that context, and why people will do things in very rule-bound environments that can make them lose sight of their own personal accountability. And there's a lot of evidence for it. We've had behavioral science evidence for this sort of stuff for years. I mean, some of your students may remember, or you should look it up if you don't, the Stanley Milgram experiments of the 1950s, sometimes called the studies of obedience or the electrocution studies, which showed very profoundly that you put people in a very rule-bound environment, they disassociate their own personal responsibility for their actions, even if those actions could be causing harm to others. And that was a pretty profound learning about humanity. And yet we didn't really didn't understand that or take that forwards into the wider thinking about how we manage people in organizations. And as I said, have gone through a long period of time where the prevailing view seemed to be write more rules, write more policies, write more processes, and that's the way to manage people. As somebody said to me not long ago, it's like we've treated people like bad robots. You know, good robots do what you tell them to do, you just program them. Bad robots, you do all sorts of other things. And there's some truth in that. Not universally, but I think generally it's been a truth of a philosophy about how we manage things, and we have to move beyond that. And as I said, I think you can see examples of that very clearly and how we have to think about public health.
So the response of Jeremy Hunt, the Secretary of State for Health, to the Mid-Staff's inquiry was that one needs to bring about a greater culture of transparency and openness, and there's a duty of candour. Quite lofty aims, perhaps slightly rhetorical. Do you feel that a culture can ever meaningfully be changed, and how does one go about that? How do you create a greater culture and openness within public health? Yeah,
you can. You can always shift culture, but the understanding of it and what are the different levers you have to exercise. It's a very sort of systemic thinking. It's not one thing that will shift culture. It's all the way from tone from the top onwards. And actually, this idea of greater transparency is not just about public health. It's about business and even government everywhere. Much more. That if we want to re-establish trust, and I do genuinely mean that, re-establish trust in what many might call the establishment, whether that be political leadership, business leadership, public health, or anything else, then part of that has to be a greater sense of transparency, because then we can all see what's going on and hold people to account on that. But I think that the challenge is transparent on what, and the challenge we have in a lot of things, particularly in these sort of big public agendas like health, is that governments naturally will seek transparency or management of these big agendas through lots and lots of metrics, endless metrics, because that's probably, certainly in traditional ways of thinking, the best way that I can carry out a duty as a politician or a political agency overseeing things like health or education is, well, here's all the metrics and here's all the numbers that you've got to deliver to, and that's my way in which I will try to exercise my duty as a political leader in ensuring that health is doing what it needs to do. The problem is that we've gone too far down that, and you do end up in this situation where people are chasing endless metrics as opposed to really understanding what they've got to do. And of course it's very hard to make all, with that number of measures and metrics, make them all align effectively. So what's remarkable to me is I've talked to, quite a lot within the health service and Public Health England and so forth. You can talk to heads of trusts in the UK where they will say, well, I've got literally almost 100 or certainly beyond 50 to 100 metrics, which at the highest level of a trust, we're all trying to understand. Well, that's a really difficult thing to do. And if I look at in most businesses, you wouldn't say you got 100 different metrics at the highest level of corporate governance that you're trying to understand about a business. You have a few that are really fundamental. And yes, you may have some breakdown in the organization. So there's a paradox in that, and it's a tough one, because as I said, government will seek to exercise its responsibility and delivery of public service, and its easiest way that it can show that is here are all the metrics, here how we're performing against all these metrics, and that's when we then talk about transparency. We're just talking about being transparent about all these metrics, or we're being transparent about what is the real purpose and outcome of, say, public health, and what's it there to do. And that's a paradox, and it's a paradox in business too, because as I said, we've driven ourselves an awful lot about just as long as we can measure everything and hold everybody to account for all these measures, then everything will be fine. Well, actually, it can distract from the purpose, it can disempower people, and then, as I said, you end up in this culture of endlessly chasing numbers, as opposed to giving people the space to exercise their responsibility and their accountability, but whatever level they are, to deliver on what we're all here to do. One other example I give you, which I've always been very interested in, is the military, which might not appear as an obvious analogy to things like public health, but it is a very good model. And years ago, there was the Secretary of State of Defense in the United States called Donald Rumsfeld, and he came up with what is generally known as the Rumsfeld Doctrine, and it was this idea that the world had moved beyond these big power blocks of Cold War into conflict, which was very disaggregated and very confused. So it said that what you had to do is to let the teams on the ground make a lot more decisions. It couldn't be big command and control and somebody sat in big command centers telling exactly what everybody was supposed to do minute by minute. And so it was enshrined in these ideas of what's known as mission, command, and objectives. So everybody's very clear on the mission. We're all very clear what we're supposed to do here, what are the purposes of what we're trying to do, the big rules that would govern that, so rules of warfare or whatever. But within that structure, you then train leaders all the way through the system so that they can take accountability for their actions on the ground, and that they will be the ones having to make a lot of decisions about, do I engage with that person or what do I do? Out of that came ideas like situational leadership and so forth. But it's a very interesting model where they've taken, all right, let's set much broader parameters. We're all very clear on what we're here to do. And these are the absolute rules which we cannot transgress. But within that, we've trained leaders and managers at all levels so that they can take decisions and take accountability for their actions on the ground. And that's very broadly what we're talking about, I think, in a lot of these contexts now.
The last theme I wanted to discuss with you is around the role of managers. So the proliferation of targets has somewhat influenced the manager being viewed as a bit of a clipboard-wielding bureaucrat. And often management, you could say, scapegoated, maligned within the healthcare sector. Do you have any thoughts about that? And is this something that we should be thinking about overcoming?
I think, first of all, yes, it's something that's very important to overcome, and I agree with that general depiction that you can see a lot of tension between administrators, managers, professional managers within the health sector, and then the clinicians and the medical staff and so forth. And I think, as you said, it's a combination of things. If the clinicians and the medical staff only see the managers there simply to hold them all to account with a bunch of check boxes and endless metrics, then it's never going to create for an easy relationship. Because, as I said, I do profoundly believe that most people come into public health and the medical vocation because they believe in helping people and they want to do whatever they can to do that. That's one point. The second point is that also that people in that profession are valued because of their technical and professional competence. So that there's a bit of, as in all these things, both sides meeting in the middle. On the one hand, I think, in public health, a bit like, other sectors like higher education, engineering, things like that, where actually what people see as the core competence and what most of them needs to be respected, promoted, and everything else is the core technical competence of professional health care, clinicians and consultants, but also medical staff through the system. And yet at the same time, they're not also seeing that they have some other responsibilities in leading and managing the workforce, in encouraging others, in training people and so forth. And there'll be varying degrees to which people see that. Then that also is part of the tension. So I think what we have to do is find ways in which we can obviously make sure the two are working in concert. We've got to find ways in which the more administrative side of the health system backs away from just being seen and indeed sometimes just trying to deliver on endless metrics and reporting. And that's a difficult one to say because there's a top-down pressure from the Department of Health and things like that to really engaging with the medical side of the healthcare system, so the nurses and doctors and so forth, to say, all right, how can we work together and recognize we have some very shared agendas here, that in order to deliver the right outcomes, we've also got to make sure that you as medical professionals understand your own role in leadership and management of others and what that means. How do you bring teams together? And we've seen a lot of evidence at the higher end of the profession that because people are promoted and revered for their specialist competence, that they're actually not terribly good at sharing it, even in amongst their own teams. But I think a lot of the debate about the future healthcare systems are a lot about collaborative and systems thinking, about bringing different specialisms together and how we most address the challenges we have together. There are very few medical problems that don't require actually more than one specialism, and creating these more collaborative and sharing frameworks within the profession, which are at the very heart of a lot of leadership and management ideas today. And therefore empowering down through the organisation also this idea that I've got to build teams that can work together, which we trust each other, share across specialisms, share information together and so forth in order to deliver the right outcome. And it's not just about me as a specialist or me as an individual. So, as I said, I think like most things in life, you can look at both sides of the equation and say, well, it's actually about what have we got to find in the middle that helps us understand. And to some degree, that means both sides have got to recalibrate how they think about some of the problems and some of the things and the solutions they're trying to bring. But it's very important we do it, because I agree, I think there is a bit of an innate tension between professional managers and professional healthcare specialists in terms of how they view the world, how they view life, and what they think is important. But in the end, it's got to be the combination of the two that delivers the best outcome.
Can you tell me a bit about those agendas? So we talked about the metric side, perhaps, of management, but how we view life.
Yes.
How would you describe that?
I would say, I mean, so for example, when we are training medical staff, why wouldn't we train them about the basic dynamics of team management and how you bring people together and share stuff and empower and engage and motivate people and teams to do what they need to do? I think there's some of that, but not a lot, in terms of a lot of medical training. You can see it in other professions, as I said. Lawyers would be another example, or finance people. I mean, we as a professional body get engaged with a lot of different groups now, technologists and others, you know, computer specialists, because where, as I said, you have this idea that at the very heart of what defines me as an individual is entirely about my professional competence and proving I've got these deep technical skills, and I get promoted for that, then I may be a little bit blind to all these other things and about my responsibility to share that knowledge, to engage people, to get the best out of the teams that are looking to me as their leader. So for us, it's an interesting agenda, because it's at the heart of good people management. And at the end of the day, the health service is like anything else. It's fundamentally about people. Yeah, there are a lot of other things we have to worry about, of course, but getting the best out of our staff, out of our people at all levels, helping them feel good about what they do, because there are other evidence that's pointing to why this is so important. We have chronic levels of stress in the health service, have some of the highest levels of absenteeism rates amongst medical staff. Certainly when you compare it to most other sectors, they're very high. And for many other sectors, you're looking at that and say, oh my God, that's a fundamental problem. What are we doing to address absenteeism rates and stress rates in the health service? And of course, yes, there's the endless debate about money, which will probably always be there. But it's also about how do we make sure that we've created the environments which support people, which listen to people, which give them voice, that recognize that actually, yes, you are under stress, and part of my job as your manager is to help you deal with that, not just pile more onto you. So it's those dynamics which become just as fundamental. So we're looking at other metrics within the health service, not just, you know, all the patient outcome stuff, which is so important, and waiting list times and all these other things which we're all very familiar with, but these other things that indicate culturally, have we built environments across all of the health sector that gets the best out of people? And if you're looking at these people metrics, which we haven't looked at anything like enough in consistent ways in health service, then there are a lot of big signs there that we have got to get better at some of this looking after our people, wellbeing agendas, leadership and management stuff, that's got to work right across the sector. And that's really, really important. I mean, other things like bullying and harassment. I mean, you look at stats like some of the stats that I see, and you think, wow, you know, that really shouldn't be tolerated. And it is very counterproductive to good outcomes, which are fundamentally being delivered by people. If they feel that they're not being supported, they're not being listened to, they may even be being bullied and harassed in their workplaces in different ways, some subtle, some less subtle, or they're not being given the resources they need to do a job effectively. And of course that's going to affect them individually, as well as the work that they do. And a lot of this is also coming together now right across the debate about the future of work and this idea of what is good work. What is a good job? And there's been a lot of reviews on that. It's something we're very engaged in. And you look at the parameters, and you go survey, talk to lots of people. What are the parameters of a good job? And they range from things like, my job has meaning and purpose, and I understand it, so it's linked to higher purpose and objectives and all of that. And as I said before, in the health sector, that should be fairly apparent. Am I paid fairly for what I do? Am I supported properly for what I do in terms of resources and training and other things? Is the job utilizing my skills effectively, or am I doing a lot of nonsense stuff that actually isn't using all of my skills? Do I have voice? Which is a very important one, so if things aren't working, can I explore that with my manager, or is my manager not listening? And then interesting, we look across all those parameters and you add them up, and then you ask people things like, so health and well-being is another very important dimension of work. And then you ask people across these different dimensions, what's most important to their own personal job satisfaction? And interestingly, things like well-being comes out really, really high. Because if I don't feel that the workplace I'm in is supporting me, that I'm massively overstressed and nobody's listening to me, then that has a very detrimental effect on my own personal motivation and engagement, and my willingness, therefore, not just to do what I've got to do and don't worry about anybody else, but my willingness to engage with others so we can work collectively. They are fundamental dynamics of healthy workplaces. And we need to understand these things in the health sector as much as anywhere, because, as I say, it is going to continue to be under pressure. It's very hard to imagine any world in the future that magically all the resources will appear and all the staff will appear and all the money will appear. So it'll always be a sector that has a lot of pressure. But we've got to find ways to release that pressure in order to help people to give more of themselves, and that we get more out of the resources that we do have. And I think it's that fundamental.
So to sum up, Peter, what's the take-home message?
Well, I think the take-home message, as I said, is that in public health, as in any part of business, we've all got to think more clearly and substantively about these dynamics of our workplace, about people, and about how we engage and manage people effectively as part of a wider systemic way in which we approach work, in which we approach the future of work. And that we've got to embed that thinking much more in all sides. We've got to embed it, as I said, I think more deeply into public health and healthcare professionals, whether they be more the medical trained staff or the management of the business, the administrative staff, and make this a very common and shared agenda between all of us. And we've got to be able to therefore step back a bit, because it's very hard in the health sector, because there's so much pressure, so much going on, so many metrics we all have to try and hit. Somehow to be able to step back from all of that and saying, are we just getting distracted by all these detailed things? And saying, what have we got to do to make sure we're building a supportive culture in our organisation, that the managers and leaders at every level, wherever they come from, are understanding their role in creating supportive and engaging and well and healthy workplace cultures, and that we create that as a paramount agenda, and that we are looking, whatever metrics we have, that we are really looking at and understanding some of the measures that I think are absolutely out there, which are indicating we have some work to do in this space. And then finally, through all of that, I think that we look outside the public health sector and we learn from others. I mean, I've always been a strong advocate of that view, that we can so often be very buried in our own world and our own sectors and believe it's all very different from everywhere else. And of course, there are lots of things that are different about health and public health. But equally, these things I've talked about are universal, and we can learn from a lot of other places as to how have they started to adapt and think about this stuff differently. I mentioned the military as an example, but there are many other examples, and I think being able to bring some of those learnings and giving people the time and space to look up and look out from their world and understand actually there are things we can learn from elsewhere is also important in building our confidence that we can actually make a difference, because these are challenging agendas, and anything to do with things like corporate cultures takes time. So I think for all of us, having that curiosity, looking up, looking out, learning from others, because there's so much more debate on all these issues of what makes healthy cultures, the well-being agendas and so forth, that we can learn from many others. And in the end, public health is one of the most important societal things that we all have. We all recognise its importance, and I think it's very important that we do reach out to others to help the sector itself in a lot of things that it hasn't always necessarily seen as at the heart of the debate, but I think are at the heart of the debate. All these issues of how we look after our people within the sector and help to get the best out of everybody.
Peter, thank you very much.
Pleasure. Thank you, Maria.